MMT scapular elevation. Stand behind the patient. It may be necessary to stand on a stool to maintain good body mechanics. Using the web space of one hand under the axilla and the other hand supporting the scapula, passively bring the scapula into elevation. Repeat for the other side. You are not assessing the infield, you are determining how much range the patient is able to move the scapula in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to elevate the scapula. This test is typically performed on both sides simultaneously. Observe for symmetrical movement. Please note that it's not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include using the triceps by using the hands to push on the thighs. The patient may also use the rhomboids to substitute. This will cause the inferior angle of the scapula to move medially towards the vertebral spine. After correcting any substitutions, ask the patient to perform the motion as previously. Standing behind the patient, place both hands contoured over both shoulders to give resistance in a downward direction. Apply the force for a 5-second count. Grade 5, normal. Patient elevates the scapula through the available range of motion and holds against maximum resistance. Grade 4, good. The patient elevates the scapula and holds against moderate to strong resistance. Grade 3, fair. The patient elevates the shoulders through the full range of motion but does not tolerate any resistance. If none of these conditions are met, we must reposition the patient into a gravity-eliminated position. Position the patient in supine or prone. If supine, the head should remain in the neutral position. If the patient is positioned prone, the head is turned to one side for patient comfort. Stand at the test side of the patient. Support the test shoulder in the palm of one hand. With your other hand, palpate the upper trapezius near its insertion at the clavicle or just adjacent to the cervical vertebrae. As you support the shoulder and palpate the upper trapezius, ask the patient to elevate the shoulder. Repeat these steps for the other side. Grade 2, poor. The patient completes full range of motion in scapular elevation. Grade 1, trace. Palpable contractile activity of the upper trapezius. Grade 0, no palpable contraction.